World Diabetes Foundation, Manipal Academy of Higher Education and District Health Administration of Udupi District jointly executing the project Diabetic Food Care Stepping Ahead. Capacity building on diabetes and diabetic food care among all levels of healthcare professionals of government and private sector was the main objective of this project. Creating awareness among public on diabetes and diabetic food complication was another important objective. Screening of high-risk people for diabetes and screening of diabetic food complications among people with diabetes were the important components of this project. Establishment of tertiary, secondary and primary level diabetic food clinic in public and private sector was the unique component of this project. This project is being led by Dr. Arun Maya Ji, Associate Dean, School of Allied Health Sciences, Manipal Academy of Higher Education. Since last 2 years, this project has been successfully executed across the district. More than 2,000 healthcare professionals undergone diabetes and diabetic food care training. Presently, they are rendering diabetic food care services at their respective health centers and community. Approximately 96,000 people were screened for diabetes and more than 9,000 people were assessed for diabetic food complications. Accredited social health activists were the backbone of screening program. Through them, diabetic food care reached the mass. This project has tried to impart knowledge and awareness on diabetic food care among people with diabetes through mass media, camps and other information, education and communication materials. Diabetic food clinics established across the district were made diabetic food care services available at doorsteps of people with diabetes. These services, which were not available in many of the private sector healthcare centers, were made available in government, was the important and a successful story of the project. Through the very good referral system, all complicated cases were made referral to tertiary level clinic at Kasturba Hospital, Manipal, that so far saved 322 limbs of people with diabetes in Udupi district. Recently, Maids Loftagar month, Program Manager World Diabetes Foundation Denmark visited Udupi district to review the project. He travelled across the district and interacted with the beneficiaries of the project, staff, officers of the Department of Health and Family Welfare. Also, he met Deputy Commissioner and Manipal University representatives on this occasion.
So my name is Mads Loftager Mundt and I work with the World Diabetes Foundation. We have projects currently in 85 developing countries around the world, and currently we're implementing this project in Karnataka province, and together with our project team here from Manipal University. The project focuses on diabetic foot, which is an increasing challenge, not just here in Karnataka but in the world. We experience that every day, every minute, 2 feet are amputated caused by diabetes. So it's a big challenge. And for my visit here these days and today, we've been visiting clinics where the project team have established a new focus on diabetic foot care, because what my experience has been from these visits today has that the doctors, the physicians, the nurses have been treating diabetes and have been seeing diabetes patients in the clinics, but there has not been a focus as such on diabetic foot. And this means that patients with diabetes, when they have developed complications or ulcers, they have not been properly treated in the clinics, and they have not been aware maybe that these problems were related to diabetes. So the project has established foot clinics now, 20 foot clinics, one at the main hospital here in Manipal University, 2 at intermediate level and 17 primary level clinics. We've visited all these various levels today, and what we're seeing is that at primary level there is now an increased focus on diabetic foot. And the physicians and the doctors and the nurses are working together with the ASHAs that have been doing screenings in the community to identify new patients with diabetes, but also to screen the known cases of diabetes and inform them about the potential challenges of diabetic foot, to get them to go to the clinics, get a proper checkup, and hopefully prevent that these measures develop. And what is so good about this project is that there is this comprehensive approach with the community workers, with the doctors. And I think what we're seeing is that from the patients that we've met, from the ASHA workers, that there is definitely more knowledge, more awareness of this problem now. Patients are getting educated in a more comprehensive manner than before and are getting treated better simply. But we're only covering with this project 20 clinics in Udupi district, and there's still so many clinics to be covered, and the core problem of preventing diabetes is still there. So I think the biggest takeaway from this is that hopefully it can inspire the district government, the health authorities in Udupi, but also in the rest of Karnataka. Hopefully people can learn from this comprehensive approach, and we'll see similar type of projects or even a comprehensive project from the government with an increased focus on diabetic foot. So there's still a long way to go, but I will say I'm encouraged of what I've seen today.